Good afternoon. Thank you all for tuning in to our public health lunch conversation today. We are honored to have Stacy Paul, Senior Policy Analyst at Every Texan. She's going to be she's going to have a conversation about improving access to health coverage and care in the 2030 Texas Legislature. That is going to be moderated by our member, Christine Riley. We are, again, very honored to have Stacy with us today. And I'm going to let our medical student board member, Yumna Ali, to introduce them. So, Yumna.
Awesome. Thank you, Dr. Estrada. So our lovely speakers today, first we have Ms. Stacy Pogue, our guest speaker, and she's been a health policy expert at Every Texan since 2008, focusing on the Affordable Care Act, Medicaid, consumer protections in healthcare, and women's health. She has twice been selected to serve as a consumer representative to the National Association of Insurance Commissioners and has been recognized by Families USA as the Healthcare Consumer Advocate of the Year. She is a founding member of the Texas Women's Healthcare Coalition and the Cover Texas Now Coalition. Stacy previously worked on health policy with the Texas Medicaid Agency and the Texas Department of Insurance. Stacy holds degrees from Texas A&M University and the LBJ School of Public Affairs at UT Austin. And second, but definitely not least, Christine Riley, our moderator this afternoon, is a registered nurse, policy analyst, and public health advocate. She's passionate about achieving affordable and accessible healthcare for everyone, starting with those most vulnerable in our local Texas communities. Christine pursues healthcare reform initiatives through research, writing, social media, and networking.
Awesome. Thank you so much, Nina and Dr. Estrada. This is really cool to present with y'all today and talk a little bit more with Stacy. And thank you everyone for attending. It's very exciting and we're glad that you're all here. So yeah, Every Texan. Stacy, can you tell us a little bit about the organization and the mission of Every Texan?
Of course. So we were founded, let me see if I get my nuns up. We were founded in 1985 by the Benedictine Sisters of Fernie, Texas, to increase access to healthcare for poor Texans. And my organization now works on a lot of additional issues: equitable education funding, access to the ballot box, access to food, and decreasing hunger. But all that's kind of tied back to our vision of making sure that people from all backgrounds can get opportunities and thrive. So so we've changed our name a couple years ago from Every Texan to from Center for Public Policy Priorities to Every Texan. But we are doing a lot of the same work, right? We're still doing research, policy, legislative advocacy at our state agencies, but also really trying to deepen and build on our work in communities through coalitions, through partnerships with grassroots organizations, and being a more effective partner in community engagement efforts. So that's Every Texan.
Cool. And you guys focus on a lot of different areas like education and equity and equality, food security, and healthcare is the one that we're going to be kind of narrowing in on today. And so I'm sure you guys have lots on your agenda for the legislative session, but for what are some of your top priorities for this upcoming legislative session in 2023, kind of narrowing in on the healthcare stuff that you guys are working on?
Yeah, so I'll cover a couple, I think, through the presentation, but starting broadly, we're going to look at access to coverage, access to care, and in removing barriers to enrollment. That's become a big one this year, and I hope to drill down on that more. And then hard to separate from health is access to food and getting rid of hunger, and we've got a bunch of stuff in that area. A big one now is vehicle asset tests. So you know how inflation made the value of our used cars sitting in our driveways and in garages go up over the last year? That knocks people off SNAP. because the value of their vehicle increased. It's a ludicrous problem to have and one we can fix. So sorry, I won't go into that one more, but the big one on healthcare rate that we've been talking about for years, and I recognize a whole lot of names on this call, so you will not be surprised when you hear me say Medicaid expansion remains, one of our biggest legislative priorities and one of our biggest kind of big campaign pushes because of how transformational it would be.
Mm-hmm. Yeah, can you tell us a little bit more about the history and politics behind the efforts to expand Medicaid in our state, and kind of why we haven't expanded when we've had the chance in the past, and what's kind of been holding us back on expanding?
Yeah, I will. And I think there's gonna be other people who have some really good takes on this call too. But to back up, because this is my job, to fight for Medicaid expansion, I'll just make sure everybody knows. And although I recognize a lot of names on here, I'll make sure you guys all know Texas has the highest uninsured population in the nation, and not by a little, by a lot. When you look at the percentage of people uninsured, there's just not another state that's close. So 18% of all Texans are uninsured. That's 5 million people, and about 1 out of every 4 working age adults lacks insurance in Texas, and not because they're not working. So Medicaid expansion is a state policy that's optional now under the Affordable Care Act to pull down a mountain of federal dollars. Our tax dollars that go to DC can come back home if we would say adults that are near poverty or just above the poverty line would have access to Medicaid. And why I say it'd be transformational is because it would reach about 1.4 million Texans who are uninsured today and make them newly eligible. So maybe 3 out of 10 of our uninsured population, a big swath. 8 out of 10 of those folks who would get Medicaid expansion are in working families. They might work full-time year-round, right? And just don't get offered insurance at work. Another really important thing to think about when we're talking about equity is that 3 out of 4 people in our coverage gap, people who could get Medicaid expansion but are uninsured today in Texas, are people of color, Texans of color. 6 in 10 are Hispanic Texans. That, not taking this step just maintains and tolerates these vast inequities in access to coverage, which then limit access to care. So this gets a little bit more to the political question of what is happening here. So there's a bunch of holdout states. Let me be more accurate. There are 12 holdout states. There's not that many, right? Most states have expanded Medicaid. You can see on the map here, the orange states are the ones that haven't. And there's a clear geographical pattern concentrated in Southeast United States, where there's higher rates of poverty, less access to health care, often bad, poor health outcomes, right? So Texas is one of the 12 holdout states where political opposition is strong enough to overcome public support. We've been able to demonstrate public support for years. Our partners at the Episcopal Health Foundation do public polling that finds, I wish I had it in my slides so I got it right, but something like 64% in the last poll of Texans support Medicaid expansion, right? So we don't have a problem with public support. We don't have a problem with stakeholder support, right? The Texas Association of Business, conservative county judges, all of the healthcare stakeholders, everybody's for expansion. Our problem is a political, that there's leaders at the top in Texas who aren't. Let's see if I won't go that far. So I'll stop here and say, the history is we've been working on this issue since Medicaid expansion became a state option. The first session was 2013, and haven't been successful at passing it in Texas yet. But I think something that's important to note is last session in 2021, stop sharing for a second, we got closer to passing Medicaid expansion than we had been in the past. And there are, the way we know that is the last session was the first time we had a bill to expand Medicaid that had more than half of the members of the Texas House signed on as co-sponsors. That felt a little earth-shaking, I think, within the Capitol establishment to see 51% or 50% plus one of the members signed onto that bill, including several Republicans. And it meant folks at the top, again, in leadership who are opposed to Medicaid expansion had to really scramble to keep a budget amendment vote in support of Medicaid expansion from passing. It also meant, this doesn't feel like a great consolation prize sometimes. It also meant there was enough pressure on leadership, specifically the speaker, to get him to support and champion a package of bills, many of which did good things, but stopped well short of Medicaid expansion, right? But did good things to move us forward on healthcare. It made for the first time leadership in the state say, we're not going to just say no to Medicaid expansion and no to healthcare. We're going to say, look at these other things that are pretty good. We'll pass those. And I think that is a testament to the organizing work and the hard work that folks have been doing for years. It's not enough. We didn't get Medicaid expansion, but there was an improvement in postpartum coverage. There was an improvement in red tape that kicks kids off coverage mid-year. And my understanding is that's the same kind of package that we'll see again this year as a proactive healthcare package that's packaged by leadership, particularly the Speaker of the House. That's not going to be Medicaid expansion, to my knowledge, that'll have ways to move forward that are good ideas that we will like. And so I think there's kind of been a shift, at least under the speaker, of it being acceptable and tolerable for the only answer on healthcare is no. No, we won't do anything, to what can they do. And I think getting all those House members to sign their name as a bill sponsor was a big piece of creating that shift. But that's not enough, right? It's not enough to get 50% plus one of House members. We need the governor and the lieutenant governor. And I'll just be frank with you, right? That is where we've always, that's why we've been unable to move forward in Texas, right? We don't have support of the governor and the lieutenant governor yet. So hopefully that answers the question. But that's, it's up at the very top where we've got our challenge and where we've got to focus our efforts.
Yeah, and thanks so much for sharing that data. And I think the background and the history of these efforts is really helpful in moving forward. And we've definitely seen some progress. And it's a good reminder right now to vote, since we're in the middle of early voting. So can plug that in there. We do have some questions in the chat box. I was going to wait until the end of the presentation until we get through these questions, and then we can move on to those. So, but everybody else in the audience, please feel free, if you have questions come up, you can definitely type them in there before you forget it, and we'll get to those shortly. But moving on to the next question, we wanted to talk a little bit about COVID and that public health emergency that status is expected to end soon, and that will likely trigger a wave of Medicaid renewals and backlogs and put healthcare coverage at risk for more Texans, for potentially millions of Texans. And can you tell us what is happening there and what to look out for?
Yeah, I sure can. I appreciate that. So we have been in a position since March 2020, right? The advent of COVID here, that disenrollments in Medicaid have been on pause. And that has never happened, at least in my career before, that for such an extended period of time, people haven't lost Medicaid coverage. So it's linked to the federal declaration of the public health emergency, which was just extended. It will likely expire in January or April, but I'm using a crystal ball to say that. So we don't know when exactly. It'll almost certainly be in 2023. It could be as early as January. And that is a massive challenge. One is our enrollment in Medicaid has gone up, as you'd expect during that time period, significantly, from about 4 million people before to about 5.5 million people now. So there's definitely some people who are ineligible. Say a pregnant woman who had a baby 2 years ago would not be eligible for Medicaid anymore, on average. But there's a bunch of kids who are on and would be eligible the whole time. But before, when we could kick kids out, mid-year, we would have seen these kids churning in and out of Medicaid constantly. And they don't know until they show up at the pharmacy counter to pick up their inhaler that they've lost Medicaid and they've got to reapply, right? So it's really cut down on churn, but there are some folks who will need to be removed from the program when we resume regular renewals. While also stop getting enhanced federal funding. So far we've pulled out an additional $6 billion in federal funds that's linked to this disenrollment pause to cover the costs of extra people on Medicaid, right? So there'll be a bunch of changes when this unrolls, but the biggest threat that I need to make sure you guys know about, you're talking to your communities about, you're talking to your patients about, is about half the people in Texas Medicaid haven't renewed during that public health emergency. Probably they've moved maybe 2 times, maybe 3 times. The agency doesn't know their address. They're not getting their information, or they probably would have taken action. And when those disenrollments get turned on again next year, they're going to lose coverage if we can't all reach them and get them to update their address and return their renewal form. And it's a little bit like a train that's coming at you and you see it, and you cannot stop the train wreck. But when this gets turned on, there's going to be a huge burden on the eligibility system. It is already burdened. We already are waiting months for Medicaid applications and months for SNAP applications to get processed because the agency's severely understaffed. They are working like crazy to remedy that, but they only have so many tools to get extra bodies filled into eligibility positions. So they're asking for more money next legislative session, which I want to give them a lot of credit for. But there's no way legislators can get that check written, if they're going to write it, get it written in time to have trained eligibility staff on when this unwinding of the public health emergency happens. So Texas will reinitiate roughly 3 million Medicaid renewals over a 3-month period. You know, they used to do that in like 9 months. They're going to do it in 3 months. And we will see mass disenrollments after that happens. Again, if we can't, and if the state doesn't do a better job of reaching those folks, updating their addresses, and making sure they have the information they need to act. And in addition to mass disenrollments, we will see chaos in the eligibility system. And I'm saying that because we already have chaos in the eligibility system, right? There's no meaningful plan at the agency level to explore the flexibilities. If we're already understaffed, if we're already taking months to process SNAP and Medicaid applications, and then we add 3 million to the pile, you know, there are ways the agency could explore flexibilities to automate some functions and take the burden off eligibility workers, but the state's not making any plans to act on those flexibilities, right? So the state has given a plan that is pretty unrealistic in the best of times, and really unrealistic given the constraints of our actually unwinding. It's going to happen faster than it has to under federal law and with a lot fewer staff. So I think it's just important to know that that's all coming, that there's a huge public education role that we can all take part in. And the other thing that's on the slide to know is that this is always true. The people who are going to be hurt the most are people in communities of color in Texas, right? When kids lose Medicaid in Texas who remained eligible all along because there's a barrier in the enrollment process and a barrier in the renewal process, and the state didn't bother to even look at the databases to get an updated address. 3 of the 4 people who lose coverage will be kids, and they'll mostly be kids of color. They'll mostly be Hispanic kids who get hit by these barriers in the system that we could remove and haven't. And there hasn't been leadership to do that yet.
Wow. Yeah. Super important to be as proactive as we can here. And we're definitely constrained by funding, by the legislature, but just looking at some of these comments in the chat, looks like Elva says we're already educating Medicaid recipients regarding the end of the public health emergency. And I think that's super important. And you touched on that, just to keep educating and letting everybody know that be prepared. The public health emergency isn't going to go on forever. And then Jundo is saying UHS connecting kids to coverage has their own HHSC enroller, which speeds up the process substantially compared to the central office in Austin. So any way that providers can, or those who are specialized in enrollment can kind of facilitate that process and make it happen sooner, I think would be super helpful. Kind of along the same lines of Medicaid coverage for postpartum moms, legislators did extend that from 2 to 6 months in the last session, but we know that most other states have a 12-month postpartum Medicaid coverage, and that's what has been recommended by maternal health experts. And what is every Texan hoping will happen in 2023 with the postpartum coverage?
All right, this is one where we have a lot of opportunity. So hopefully this is going to be a good news story after the next legislative session. But yeah, as you've already pointed out, and all the folks on the call know, experts in maternal mortality, obstetricians, gynecologists, physicians, all point to having 12 months of continuous coverage after you give birth as being, a foundational requirement, even though it's not enough alone, but like building the foundation for maternal health postpartum, and then getting the access to the care you need. So last session, like you said, we saw a bill to extend coverage that started as a bill to extend coverage for 12 months postpartum, and that's how it passed the House with clear and vocal support from Speaker Phelan, the Speaker of the House, the Republican Speaker of the House. But when it got to the Senate, it was whittled down to 6 months, and that's how the bill passed, and that's how the bill was signed into law by the governor. But what we didn't know, we didn't have a crystal ball then, is that one, we were kind of a leader at that point 2 years ago, but since then, it's something like 2/3 of states have started, more than half have already put in place 12 months, and a bunch of other ones have started the process, right? So now we're not even leading. But the process that was passed in the bill was this long, it was a waiver process, a Medicaid waiver process. And without explaining that, I'll just say there's a couple different ways you can go to the feds and ask for permission to change your Medicaid program. There's the easy way and there's the hard way. And we asked for the hard way. But there's an easy way to do it. So the bill hasn't been implemented. It's going to require these complicated negotiations between the state and federal government, and their goals for Medicaid don't align, right? So it has not been approved. It has not been implemented. At this point, the fastest way we can get postpartum coverage to moms, let me say what that means. That means, to be clear, to connect the dots, that in policy, it doesn't matter what we passed last session, the policy on the book says moms in Medicaid in Texas lose their coverage 2 months after they have a baby. They're not right now because that pause on disenrollments from the PHE. But if the PHE is lifted in January, listed in April, Texas goes right back to removing moms 2 months postpartum. Because that's what's approved, that's what's in the policy, because the state law has not been implemented. So we could get back there, and we could get back to that bad outcome right when session starts. But I think that will help focus our legislators' attention on the fact that they need to pass a state law that lets us have 12 months postpartum, and they need to make sure that state law says the easy path, the quick path to federal approval, not the slow, complicated, uncertain path. And I think there's a lot of folks that are talking about that in the Capitol. I think they're talking about it across parties. And I am keeping my fingers crossed, but I think that, as long as we're all pushing that and telling them we're not going to accept whatever dramatic nonsense political reason there's a fight between the states and feds on who does what, we don't accept that's an excuse for Texas to not move forward. Texas has a route to fix this problem for moms, and it needs to act on it, just like Georgia and Florida and name a bunch of other red states. No other state is letting all this nonsense stand in the way. They're getting a year of coverage to moms after they give birth.
We have a lot to work on here. Another question about Medicaid coverage. It sounds like there might be a bipartisan push in 2023 to help eligible kids enrolled in Medicaid and CHIP. And what does Texas need to do on that front?
Yeah, let me see if I've got it in these slides. I'm going to skip over those. Okay. 2 barriers. I hinted at one, but really I kind of talked extensively about one. So one huge barrier to keeping eligible. So Medicaid expansion is taking people who are locked out today and making them eligible. That's a big step for our legislature. A smaller step for them is to say, okay, people who are already eligible, which is kids who are already eligible, how do we get you enrolled? We know from the data that there's at least 400,000 kids who are uninsured today in Texas, but could get Medicaid, could get CHIP. And the problem is barriers. The big barrier, and this has really evolved just over this last calendar year, so it's not a historical problem, is adequate staffing of our eligibility system. People cannot get in the door to get the services that they are eligible for, including SNAP, right? We have people waiting for months for SNAP. They're eligible for SNAP. Their SNAP benefits run out. There's no money on their Lone Star card. And they turned in the paperwork 2 months ago, and it's going to be another month or two when they don't know how to pay for food before they get benefits again, right? So we need to adequately staff our eligibility system. And the other one is looking at barriers. There's a list of barriers, bureaucratic barriers, probably some of them unintentional, that built up over time that make it really hard to maintain coverage that we don't face as people who get job-based insurance. Sorry, this is the severe staffing of the eligibility system. I won't bug you with the numbers on that, but I can send these out afterwards. So here's ones that are kind of unbelievable. The agency has a website where you can apply online to get Medicaid, and the application piece works pretty well. But if you want to renew using your Texas benefits, you have to have an account. And you have to remember your password and your username, which is hard for me to remember any of mine anyway. But remember, a lot of people applied back in 2020 or 2019 and haven't renewed since then. And so we're asking people to remember their password that they might not have used in 3 years, which is, somewhat unreasonable, to go in and renew. And then if they can't get into the system, they have to call 211 to reset their password. Well, 211 earlier this year had an hour-long wait time. I was calling it a couple times a month and a couple times a week and recording the data on how long the computer says I have to wait. And I learned something new about 211, which is it'll give you an exact wait time if it's under an hour. Your hold time's 38 minutes. But if your hold time's more than an hour, it just says your hold time will be more than 60 minutes. So I actually don't know how long hold times got to. I just know they were more than 60 minutes. That's gotten a lot better in recent months, though. There was a lot of pressure in interim hearings of capital on the agency to respond to the 211 call center, hold times, ridiculous hold times. And they got increased money to their vendor that does that service and increased capacity. And my understanding now, when I call myself, is the hold times are down lower, and I think the average is around 15 minutes. But anyway, so if you can't get in to renew if you don't wait on hold for an hour to reset your password, and then you can't get in if you don't have this, like, I'm just gonna be a little too flippant, full case access. You have to pass these hoops. You have to get permissions in the system to see your case. You and I all set up our online banking system. It's not like there's not safeguards in that system, but within 5 minutes, I can see my bank account information and I can use it, right? That is not how it works in your Texas benefits. The system is set up in a way that makes it really hard for you to see your case and renew your case and change your address, which just funnels everybody back to 211, where you can't get through on nights, you can't get through on weekends, and sometimes you have to wait an hour. So it's it's this catch-22 where you can't, there's a couple doors to get in and all the doors are broken. But besides that, there's also a lot of other barriers that keep folks from enrolling and renewing. And a really important one that I should have put in these slides and didn't, but I think I saw a question in the chat earlier about it too, was fear and misinformation. So part of one of the legacies of some of the immigration policy changes in the Trump administration is a lot of fear and misinformation in particularly Hispanic communities, but immigrant communities, and particularly mixed immigration status families. So you might have a green card holding parent and an undocumented immigrant parent and U.S. citizen kids who are eligible for SNAP and eligible for Medicaid. But because of the fear that was created in immigrant communities, the reasonable fear, right, as a response to these immigration policies, a lot of folks pulled their kids out, right, of Medicaid. You saw right before the pandemic a big drop in Texas Medicaid enrollment for kids. And the data to us point to that fear, that chilling effect in mixed immigration status families in particular of being a big driver. And so, another barrier in Texas is this fear and misinformation, because we know in most cases, those families can feel assured about enrolling their U.S. citizen children and has no effect on the immigration status or changed immigration status of people in their family. Generally, right? That statement won't apply to every single case, every single time, but generally that's true. And but the state hasn't spoken clearly to communities or found trusted partners who are speaking in communities to deliver these reassuring messages, right? And so one of the barriers is just lack of willingness to do outreach, targeted outreach in immigrant communities, but even just broad outreach, right? The state funded a decade or more ago, the state used to fund outreach and enrollment assistance in local communities, and they don't anymore, right? So one of the things we could recognize is that when there's outreach, when there's messengers, when there's funding for grants to organizations that are in communities to get the word out and to help, service uptake improves. But the state actually, and the legislature working with agencies, shut most of that kind of outreach funding and community-based funding down. And it's certainly not looked at that targeted outreach we need in our immigrant communities. So that all creates barriers.
Yeah, there's a whole list of them. It's really difficult to move past those, and I think there's always going to be barriers, and hopefully there will be more willingness at some point to help these people get connected and help them through that process, because there seems to be a whole list of things that are, I guess, ways that I don't think we're intentionally trying to not make it easy, but we're not making it easy at all for people to get these benefits. If members in the audience want to stay up to date on these key healthcare policy issues that Every Texan covers, and take action on some of these, or hopefully make some progress towards change in the right direction, what can they do?
All right, I've got two things for you. And again, because I recognize some of these faces, I think you guys are going to know about these, but one is Cover Texas Now. It's a coalition in Texas that's focused on expanding healthcare and health coverage. Healthcare and health coverage. It's a coalition of organizations that are working on these topics, but it also has this great listserv written by a very good communicator. It's not me. To keep things simple and to always tell people about what's the most important thing that's coming up and what do you need to know about it. So you can sign up for our email updates. And this is an example of the last two blog posts that went up on Cover Texas Now, was about the focus on the end of the public health emergency and the new data on uninsured folks in Texas. I know I already gave away the headline on that one, but Texas is still in last place. So but go ahead and read the whole thing if you want all the information. So that's Cover Texas Now. That's an information network, right?
Mm-hmm.
But we also have a campaign for folks who are ready to take action and speak out and try to put the pressure we need on the leadership in our state to accept Medicaid expansion and take other steps that help improve access to healthcare. So this gives you, this is a screenshot of some of the recent actions from Stick of It, Texas. They released a healthcare voter guide. So if you're going to town halls to talk to your elected officials, here's some questions you can ask them to make sure healthcare and health coverage is part of their dialogue, and that they know their constituents are thinking about it and talking about it. And the other ones are, you send letters to legislators, send the letters to Congress, demanding healthcare coverage and Medicaid expansion now. So those are two separate campaigns. They're linked. A lot of the same people run them, but again, one's action focused, kind of grassroots focused, and the other one's more organizational policy updates from the Capitol.
Mm-hmm. Yeah, those are great resources to have. Thank you so much for this awesome overview of the agenda that y'all are working on, and you've given some great detail on the healthcare aspects of this agenda, because it's quite a large agenda. And at this point, I wanted to look at a couple of the questions that came in, and let's see, it looks like the slides will be, those can be shared. And Elva earlier asked, is there data to show why Hispanics who potentially may qualify for Medicaid for their children do not apply?
I'm happy, if this links back to the chilling effect question, I'm happy to share both the quantitative data and like the anecdotes we were getting from partners, and probably including some folks on this call, about the conversations they were having in their communities with immigrant families, to point to where that chilling effect fear was coming from. But then more broadly, I would say there aren't terribly good data on what are the specific barriers families are hitting on keeping their kids enrolled. Oh, maybe that's true and not true. For the first time a couple sessions ago, we got great data on some kids are kicked off Medicaid before they have 12 months of coverage mid-year. And what we found in that data that we requested for a long time and finally got years later was often kids who are kicked off of Medicaid from some mid-year red tape problem, which we improved last session. Problem hasn't gone away entirely, but it got better. Most of those kids come back, right? In 2 months, 3 months, 6 months. It wasn't a question of whether they lost eligibility. The question is whether their parents could jump through the hoops of paperwork, of phone lines, of hold times to keep their kids enrolled, right? So yeah, I think there's so many barriers in the system, but I would say, I will propose there's not enough research to pinpoint, if there's one barrier outside of immigration status concerns. That is a known one and affects immigrant communities. But outside of that, which of those barriers is really the one that's driving, creating the most hassle factor for families?
Interesting. And earlier, Junda asked if HHSC LAR requests more enrollment processors. And LAR is, I'm not sure what that acronym stands for. Do you know?
I can do that one. So it's the budget ask from the agency to the legislature. It stands for Legislative Appropriations Request, but it's the budget wish list. And every agency has sent one over. And a number of agencies have asked for money for staff, right? Agencies are having a hard time, like all employers, keeping the staff they want. So that the HHSC did request, it is their Legislative Appropriations Request Exceptional Item 2 for wonks on the phone, to pay eligibility workers more so we can keep them on staff. It's not just eligibility workers. You guys will know that Health and Human Services Commission has staff in hard to fill jobs. People who work in our state hospitals, people who work for Child Protective Services. Like, there's a bunch of low paid, hard to fill jobs. Eligibility workers are a classification of those jobs. They are struggling to keep eligibility workers, but I don't want to in any way diminish how critical other roles are that are hard to fill in that agency. So the agency did ask for a bunch of money to give salary increases to eligibility workers. So not to hire more of them, which they probably need for the end of the PHE, like probably current staffing levels aren't enough, but they're not at current staffing levels, right? First, they need to, I guess, stop the hemorrhaging. So they want money to increase salaries, which I think is going to be very helpful. Yeah, for eligibility workers and some other really critical folks in hard to fill positions.
Yeah, it seems like it's important to invest in the ones that they have, as well as get more, retain the ones that you have, and then make that a more attractive job, and money talks, definitely. It's, the rest of her comment, it's really important to support this request, follow through. HHSC seems well behind in processing Medicaid, CHIP, SNAP, HIV medication assistance program even now. So definitely important to be pushy about this topic and try to get support for all of these eligibility workers. Mm-hmm. We talked about educating Medicaid recipients regarding the end of the PHE and preparing for as much as we can. And then one more question from Elva: Medicaid coverage for postpartum cover, would that cover full Medicaid benefits, or would it be limited to postpartum issues?
That's a super good question. So 12 months postpartum Medicaid would be full coverage. Right now in policy, again, it's on pause. It's on pause for the public health emergency, but right now in policy, a postpartum mom would have 2 months of full coverage after she had a baby, and then be transitioned to a program called Healthy Texas Women, which is limited family planning and a couple postpartum benefits. It's a limited benefit package. If you get the flu or break your leg or need a heart transplant, you don't get those things. But postpartum coverage at 6 months or 12 months, right, as real Medicaid, as real health insurance, is comprehensive. And so that's where we need to get, and that's what the experts are pointing to, that these little piecemeal things that cover smoking cessation and cholesterol medication, right, that's going to help some moms with their postpartum health care challenges, but it's not going to help all moms. That we need a comprehensive benefit package.
Agreed.
And I'm going to shout out Stephen's point in the chat about language access. It's a huge barrier. A lot of our information in Texas through HHSC for Medicaid and CHIP is in English and Spanish only. And for example, HHSC has done this great job of putting out educational information about the end of the public health emergency. They've got an ambassador toolkit. You guys probably all have it. That's got some great graphics. Again, kind of an outreach package that the agency hasn't done in a long time. Now, they're not funding the outreach. They're like creating the materials and we're all going to send them out, right? But even that, all of it's in English, some of it's in Spanish, none of it's in Vietnamese, none of it's in any other language, right? And so that's one of the things we've been advocating to the agency about is if we are worried about hard to reach individuals, keeping their Medicaid when they're eligible, the language access pieces have to be a priority. And not just at the end of the public health emergency, right? That's just a platform for which we can build better practices that can be maintained in our ongoing outreach efforts. But a lot of the stuff in the States, just English and Spanish.
And did you know anything about the reason why people wouldn't be able to reset their own passwords? Is that just a technological?
It's technology. So, the system, like if you get locked out of your bank account, they're going to text, or you want to log in and you don't know your password, they're going to text you a code and you get it on your phone and then you enter it on the computer.
Yeah.
Our system, your Texas Benefits website system doesn't have that capacity. So we can get it. They're building it. They said that HHSC has fast-tracked it. Again, there was a lot of attention on that particular barrier during our interim hearings because we talked about 211 hold times and password resets, and they heard that, right? So they've said they're working with a technology vendor to install that functionality in the first quarter of 2023. It's kind of like the system any other website you ever log into uses, right? Is that there's a way for you to reset your password after you get texted a code, and you don't have to remember the security questions you asked that are case sensitive that you made 10 years ago. There's another way to verify your identity so you can reset your password in real time. So it's coming. I hear it's coming.
It sounds like there's so much room for upgrade in that the password reset process, and then just in the accessing your application and being able to see your case and your status of that. It could be
it's
easier.
A surprising barrier how many people can submit an application online but then can never see their case because of this extra step where you have to get permissions in the system to see and manage your case. And we have requested from the agency information on what percentage of cases have that extra permission so that they can actually change their address or renew. And we haven't gotten that information yet. But it's a barrier that's easy to gloss over because it's true that most people submit their applications online, but that doesn't mean that they can then manage their case online. And that's another, we need to make sure that mom and dad, when they leave the health center and they've signed up their kids, that they have an app on their phone that they could use to, renew when they need to, or to check how much money is on their Lone Star card when they need to. So there is an app. It's just most people can't use it because they don't have the permissions in the system. Well, I shouldn't say most. I don't know what percentage. Lots of people don't have the permissions in the system to use the app.
Interesting. Sebastian is asking, can you apply for CHIP or the child if the mother is on CHIP perinate through the Texas benefits, or does the birth of the infant need to be called in through 211?
I don't 100% know if this answer I'm going to give you is true for CHIP perinatal, which is slightly different than, just different than Medicaid for pregnant women. But in Medicaid for pregnant women, if you're reporting a birth, there's a couple different ways you report it, but most people just call 211. But you are responsible as a Medicaid client to report changes, but one of those changes is reporting a birth. The hospital, of course, reports it as well, but you are responsible for making that change on your case. And my understanding is that 211 is one of the routes to do that. I don't know if you can do it online. You almost certainly can. But I have to check if CHIP perinatal had a different process, because that one's an unusual. That one's just an unusual program compared to the others.
Thank you.
Oh yeah, I'll find out. I'm gonna write it down so I make sure I get you an answer. Okay.
And Elva was suggesting that the QR code is being used for so many things now. Maybe that could be used to take applicants directly to their case when accessing their benefits. And I'm sure if they haven't thought of it yet, then that's definitely a good suggestion. I think the QR code can make it, at least having that as an option could really facilitate easier access. But yeah, if anyone else has any questions, you can speak your question. You don't have to type it in. We can definitely open it up for that too.
I have another question. I'm sorry. I know I keep asking a lot of questions, but I
Great.
do get a lot of questions from our clients. Well, actually not necessarily clients, just people in the community regarding the fear of their immigration status and applying for Medicaid. I guess my question is, sometimes I do not know exactly who to refer them to because it could be a legal problem. I know that when they are trying to, and I'm not sure if they're trying to get citizenship or if it's when they're trying to get their green card, that they should not be applying for any services. And I never want to advise them one way or the other because I don't really know the correct answer. But some of them tell me that they cannot apply for benefits at all. But shouldn't that only apply to the parent and not to the child if the child is a citizen? Or does it affect them if even the child that is a citizen gets on some kind of assistance?
Yeah. So I want to just recognize, validate your concern and hear you. Like it is going to be impossible for all of us who aren't immigration experts and eligibility experts to give, information to a concerned client that's 100% accurate all of the time, because there are families here and there that have very complex immigration challenges and for whom the answer might not be the exact same as it is for 98% of the folks, right? So the resources I point to are two things, and I put them both here. One, the Protecting Immigrant Families campaign has two documents that are super helpful. I think the first one is this green light, red light one is, does public charge apply to me? So public charge is the test to see if you're going to be, if you're going to take too many resources from this country when you're trying to change your immigration status or get a visa to come into this country. So it's essentially like if you're going to be in a nursing home paid for by Medicaid, you get Medicaid, like long-term care services would put you in that category. But kids on Medicaid and CHIP do not put you in that category of being a public charge. So first, there's a whole bunch of confusion about if my US citizen kid applies for Medicaid, is that a public charge? And part of the confusion is because people were trying to scare immigrants. But part of it is like, well, Medicaid could count, but you're talking about a very specific kind of Medicaid for people who are, on long-term care, not kids, not pregnant women, right? Not most people who are on Medicaid. So this green light, red light series of fact sheets they have are really helpful because it says, wait, are you guys citizens? You're fine. Do you have green cards? You're fine. Is your kid applying for Medicaid for children? You're fine. Like, so it helps you. And then there's other ones that have the yellow lights and the red lights, right? And by the time you hit the ones with a question asked, does this apply to me? And you get a red light or yellow light, you got to go, you should talk to your immigration attorney, right? There's some things that we shouldn't advise folks on. But most people don't have to worry about public charge rules in any way, but they don't know that, right? They know that a few people have to worry about it, and it sounds really scary. So that document, and the other one I want to point you to is a campaign that we've built with Children's Defense Fund of Texas. It's called Seguro Texas, and we have fact sheets for families and for advocates and for enrollment assisters. And this is to give the, trying to make the clearest information about whether you need to worry about public charge, whether your kids can apply for benefits, whether this applies to you, how to get help. It's only available in English and Spanish right now, but we're working on, the next one on the list is Vietnamese. We're talking about whether we can do other languages, including simple Mandarin. I'm trying to think what else is on the list. Because language access is going to be beyond Medicaid, beyond English and Spanish, is going to be essential to distilling fears about the public charge rule. So the Seguro Texas campaign is a great way to get information, and it will also point you back to that Protecting Immigrant Families red light, green light document, which I think those are like my go-to when somebody says, do I need to worry about this? Because now I'm not an immigration attorney, but I can say, if you can answer these three questions, like, you guys all have green cards, then you have clarity. Like, no, it doesn't apply to you. You don't have to worry. You're not trying to change status. It doesn't apply to you. You're fine. So.
Thank you so much.
Oh yeah, thank you. That's a great question.
Those are great resources too for people to know about.
I will update the slide deck that I made for this and add those two. So I will send Dr. Strada and Christine a new one afterwards that has those two slides. So hold tight. Okay, just making a note to myself.
Did anybody else want to ask Stacy a question? Yeah, Pat.
Oh, I just wanted to comment that the work's never done, and that all of the techniques, particularly the communication enrollment techniques and access that are used in Medicare, are being used on all sorts of other government systems. For example, a lot of people that are not able to qualify many other services like Medicaid, for example, can apply, for example, to a Lifeline service to get a telephone or to get access to the internet. But they have to requalify every 6 months. And the state agency that's contracted to that agency to do that work for the state will get the application, and it may be more than 6 months before they actually review the application and qualify them for and things like that. So you see this sort of institutional process. And the same thing happens with the MHMRs and all sorts of other places where you have to have access. There's ways to just make it almost impossible for anybody to enroll in these services, even if they're entitled. And it's just kind of a pervasive process. So like I said, the work's never done. You know, doing all this stuff for Medicare may be great if, and in particular, if the person even knows how to use the internet, you know, to go to a library or something like that. The bottom line is, then there are these other, you know, meta institutions and things that have to do with communication that also prevent people from applying. And it's more than just language itself.
Yeah, I totally agree. It is. I think I would add in that I think a lot of those barriers to access programs for poor people have, you know, institutional racism at their core.
Sure.
And then it's not just like that was the history of why those ridiculous barriers got there in the first place. And then they just exacerbate the inequities that we have today, right? So I think it's all tied back there. But I agree with how the systems and the complexity of the systems is a massive problem, and the work is never done on that.
And a lot of the federal money that's been dedicated to these things end up in trust accounts that are held by the state agency that gets that money, and it never gets dispersed. It ends up being an account that helps balance the budget for the comptroller at the end of each legislative session. Those kinds of things, you know, billings on these public systems that end up being billed the next year, the next, you know, fiscal year, that kind of stuff, transferring of accounts and debt. There's and the state is just full of these structural impediments to people being enrolled in and utilizing these facilities. Oh, and by the way, I've got a campaign stopped for Kirk Watson, who's running for mayor again after having been a state senator and being a mayor of Austin before. And he's, in the past anyway, he went around promoting what everybody's called Obamacare and stuff like that, and spent a lot of time going around the state. And I'm hoping that he's going to be a mayor that will be a really strong proponent of restoring access to these services. So we'll see what happens tomorrow, but I'm going to surround him with a whole bunch of Democrat clubs And he's going to have to talk to people that are going to ask him difficult questions about Medicaid expansion and medical services particularly.
Well, thanks to everybody who asks all the candidates about Medicaid and access to healthcare. I appreciate that.
Hey, I have a quick question. I'm sorry, I jumped off for probably 10 minutes, and I put a question in the chat before I jumped off, so I don't know if it was addressed, but why can't people just change their own password like they can on most websites?
It's just a technology problem with the Your Texas Benefits website. The state needs to buy and integrate that technology. They are working on it. They had a very long time frame planned for that, integrating that new. It's like what we all use for every other website. But it got moved up. I think there was a lot of attention during the interim hearings on the password resets being such a like not comprehensible problem that hasn't been fixed, right? Like the legislators were scratching their heads like, wait, why can't you reset your password on the computer or on your phone? And so I think that one got moved up on the timeline. And the agency is saying in the first quarter of 2023 that they believe they will have password reset functionality on the website.
Right, thank you.
By the way, I was shaking my head when you were talking about the QWERTY, the QR code. And the reason I was shaking my head there is because even if people can get a free phone, a lot of them don't have the app on there to be or a camera on there to be able to read the QR code. Another technological barrier. So, you know, it may be of help to people that have that capability, but a lot of people won't have that capability.
Right. A lot of people still rely on going into their local HHSC benefit office. Several of those were closed during the pandemic. And there's one of the pieces that HHSC is asking for their budget is to reopen some of those offices. And so that's one of the things we're supporting. But yeah, there's no one, we can't do any one system because as great as it is to have your smartphone help you apply for Medicaid, that's not going to work for the full population. And closing HHSC benefit offices is always going to hurt our most vulnerable people. And so we have to also have those resources available to folks in the community as well.
If I may add, I'm sorry, go ahead.
And there was no mention of the continued training of promotores, at least in this discussion. And I'm curious what's going on there, what plans there are for the coming 2 years.
I would have to ask somebody else who's an expert on that here, but I agree that the healthcare providers that are community health workers, promotores, there needs to be a bigger investment in making sure that they can reach folks in Texas, including funding. But it's not one of the things we take the lead on in my organization. So,
and also the licensing and full credentialing and access of, for example, nurse practitioners, physician's assistants, other mid-level providers in this state would sure help to expand basic primary care contact for a lot of people.
right. Yeah, there's a coalition for that led by the nurse practitioners that we've been a member of for years and years and years. And that's I don't have to tell folks on the phone that it's a big uphill battle, but it's one that we'll all keep at because it's going to be important to let all of our healthcare extenders, all of our nurses, all of our social workers, all of our licensed clinical therapists, like our non-MD level folks practice to the extent of their license because they're such critical healthcare providers, and we have such a lack of capacity that we need to make sure people can practice to the full scope of their training.
What I just wanted to add is that I think that we're all wanting to reach the goal of educating the clients and doing outreach. However, where there is a lot of places where we do have the resources, such as using community partners with HHSC to help families apply for Medicaid, those agencies, along with so many others, are so understaffed that, we just don't have the manpower to do the way that it should work, to have families come in and assist them and meet their needs. But everywhere you go, everyone is understaffed.
I totally agree. So the community partner program is the partnership with HHSC where a local nonprofit organization can do application assistance at your Texas benefits. So HHSC does the training, but United Way has to pay the staff member, right? Or whoever the local partner is. That's one of the things we're pushing for. In the earlier iterations of that program, it was grants from the state that went to the community-based organization to support that staff person or the computer or the internet or the office space, like all the things that you don't get for free. It would really help make sure that program could reach more corners of the state, reach more populations of people who are eligible, who are hard to reach. But right now it's just hey, if you want to take our training and use our website, you can. And it needs to also come with those grants to build the capacity in organizations to do that work. It takes bodies.
Thank you so much for your comments, Stacy. And this has been a really fruitful discussion. And thank you everyone for attending. And these have been really great questions. It's 1:03 right now. And I'm going to hand it back over to Jaime. But thank you again for your time here. And yeah, this was great information to share. This was awesome.
Thank you, Christine, for a great job. Thank you, Stacy, for spending this time and sharing the information with us today. Thank you, Yumna, and thank you all for taking the time and sharing this space with us. Have a great weekend.